An awful lot of manual medicine is provided according to various models. So some would say a postural model, and so if the pelvis mechanically isn't working right, you gotta level that up or you can't get anything else working right. Then there are other people that say, no, you gotta work out of what they call a cardiovascular respiratory model. Then other people think about a cranial model or a neurological model. And I think each patient's unique. I love to say that patients haven't read the book. And so I look at each patient very unique. So I want to examine each patient uniquely and find the mechanical dysfunction that's the greatest hindrance to their normal physiology. And then select the appropriate techniques. And the common techniques I use are functional indirect, muscle energy, cranial, but the key is finding the key area, then sequencing, and to me it's like picking a complicated combination lock. You can have all the numbers or all sorts of techniques, but if you don't know the order to put those numbers in, you don't open the lock. And so I think a lot of people know a lot of technique, can do a lot of technique, but they don't get a good outcomes because they're either working out of a model or working out of a protocol and kind of cookbooking what they do rather than treating each patient uniquely according to their unique patterns of dysfunction.
And what I love about the techniques that I've learned from Ed is that it doesn't take a lot of force to do them. And I am a smaller female, and my body can't take those forces that a lot of times I see other practitioners do. And I go by the theory of work smarter, not harder with your patients. And so I've learned that from Ed over the years. And the way to do that, and the way that the reason why I think this works is it's the ordering or the sequence in which you treat the patient and finding the key area of dysfunction, the tightest area in the system where everything else is adapting and compensating for it, and not treating those compensation and adaptation areas where maybe the pain is, and forcing those things to change because those things are trying to help the weak link or the area that is key or the most dysfunctional. So once you get to that key area, you isolate it and you find it, you have to use very little force to make a change. Therefore, it's easier on the practitioner and it's easier on the patient, and you are not putting in any extra forces into that system and maybe stress that would stress the system further, but you are taking out the stresses and then allowing their body to adapt, change, and new health potential will emerge on its own.